Hey everybody, Dr. Tim Harrigan with Synergy Wellness. I have a special guest. We're going to go over some laser information and research with you. So I've got Penny on the line here. She's going to kind of help us understand some of the benefits of the laser and some of the research. And, basically we have the world's best laser on the market. So just a few things first. So this presentation is meant for informational purposes only. It is not meant to diagnose, prevent, treat, or cure anything. The content is solely the opinion of Dr. Tim, and we will be going over some research, of course. But please speak with your healthcare provider regarding any change in your healthcare plan. So real quick, guys, a little bit about me if you don't know me yet. I have not had a prescription medication in over 16 years. My kids have never taken any medications. So I've structured my practice literally based on how I take care of myself and my family. So whenever we source a technique, a tool, a physiotherapy, a nutritional product, you name it, we want to make sure we're using the best in the world because I want to go another 80 years without needing medications. Now, there's obviously a time and place for medications. You know, if I break my femur tomorrow, I probably want some morphine for a couple days, even though I'm going to be lasering it, right? There's absolutely a time. They're really overprescribed, and we can all agree, right? Chemicals don't really help us heal more quickly. So just a quick testimonial from what we do in our practice. My wife was diagnosed infertile over 10 years ago. She was told she would never have kids. She had PCOS, she had endometriosis, she was lactose intolerant. And we really have none of those issues, as you can see here now. So it's pretty cool. So what we do is we literally try to find the cause of the problem and address it. If something slows down healing, I'm not going to use it. If it improves it or increases it or helps us work with that healing process, absolutely we're going to use it as long as it's the best in the world. We're not just going to buy a laser because it's a laser. It has to be the best. So this is just an example. We actually can laser the brain. There's so much brain research out there. I laser myself literally every day, whether it's my brain or my knee that I occasionally have issues with, or a new ailment that might pop up, and usually they go away very quickly when I start lasering. So we have what's considered, Penny will get into that shortly, the world's best laser. So real quick, just laser therapy stimulates both nervous system, which controls everything in your body, and the site of tissue injury. So just some basic stuff, we'll get into more detail shortly, but it suppresses inflammation, increases oxygen and blood flow, and promotes muscle calcium uptake, and increases neurotransmitter release. So this is part of the healing process, you guys. And almost everything that you're dealing with, the body's always trying to heal. We want to give it that extra edge, okay? So this is one of my other testimonials. I don't have many testimonials because we stay pretty healthy and we prevent, do a lot of optimization and prevention care. But I couldn't believe, Penny, I don't know if I've shown you this yet. The picture on the left there is my ankle. Literally a day or two after I sprained it, I tore something down towards the foot. It popped. I literally twisted it 90 degrees and snapped. So I started lasering it 2 or 3 times a day, I think, under your recommendation. I was doing some other stuff with a CBD fluid, not oil, and some other enzymes and stuff. But I've never had an injury heal more quickly in my life. And it's probably been 20 years since I've had anything major like this happen. The upper right picture is actually just a week later. You can see how yellow and purple it is. The one on the bottom right here is literally just 2 weeks later.
That's
Now,
amazing.
it was still unstable because I did tear something in there. However, the swelling was completely gone. It looked completely normal. Fastest injury I've ever had heal. So these are just some of the testimonials we get. And why we do what we do in my practice also is this is absurd. This is not okay with us. So I have 4 children, 8 and under. This is our generation of kids now. They say the first generation in history that will not outlive their parents. Our lifespan is now going the opposite direction. We are no longer increasing our lifespan. And I know some experts, say the human body can last 130, 140 years if we take good care of it. We're barely making it to half that, and now it's actually getting worse, okay? So that's why we source these best things in the world to take care of ourselves, because I do not want to fall into those statistics. So it's kind of funny. We have a weird philosophy. Most of the time, if the majority of our neighbors and community are doing something for their health, we almost always do the opposite. It sounds really weird to some people. I was pre-med at one point. I was going to be an eye doctor. If you would have told me some of this stuff 20 years ago, I would have thought you were a weirdo, a quack, or voodoo, or whatever it was. But we've proven it worked. This is how we live our lives now. It's very effective. There's so much research out there. It's just not really mainstream very much. So part of the problem is we consume our body weight in sugar every year. Wheat it's out of control how much we consume. We eat like just a few pounds of vegetables per year, when in 1900 we actually used to consume almost our body weight in fruits and vegetables per year. So our lifestyles are terrible. Once we got into World War II, we started learning how to store food better and canned vegetables, and we've just kind of gotten so far from natural and what's good for us that most people don't believe some of this now. But it's really, when you look at history, it's really crazy. There's not really a disease that's declining right now. Almost everything is increasing. And most of what I do in the practice and with these lasers and other formulas I use is reducing inflammation. Most people go to NSAIDs. I'm going to get into that shortly, but almost every disease process is inflammatory in that particular organ that's kind of got that disease or that's injured or whatever. So almost everything is inflammation. So when we address that appropriately, we see all kinds of cool healing happen. So just a couple statistics. The FDA estimates NSAIDs account for reported 200,000 cases of gastrointestinal bleeding, 107,000 hospitalizations, and as many as 20,000 deaths. Guys, these are over-the-counters that we think are safe and effective. Well, you can see that this is really a small percentage of what's actually being reported. I've seen studies anywhere from 10 to 20% they say are being reported. So if you multiply this by 5 or 10, that's probably what's really happening, but that's what's been reported. So just a few scary statistics that I've learned about over the last few years that have changed our approach and our perception, which most of us, it's hard for us to unlearn what we've learned. It's really that simple. It's really challenging for us to learn something new when I've been told something my whole life, right? So just a couple things here. Women taking just 1 aspirin a day for 5 years had an 80% increased risk of breast cancer. Guys, this is all out of journals. This is not my opinion. Children who had received Tylenol once per year were 70% greater risk for asthma, while those receiving Tylenol once a month or more are 540% more likely to have asthma. This is crazy. I never knew some of this stuff. So I'm kind of glad we were a little bit older when we started having kids, because I would not have known this back then. So I'm grateful that that's the case. But Tylenol, this is just an article out of Green Med Info. Tylenol damages the brains of children. Most people don't realize. Ibuprofen damages your DNA, creates anemia, miscarriages, heart attacks, some cancer-causing drugs, guys. 1 ibuprofen a day for 5 years increased cancer risk by 50%. 1 aspirin a day for 5 years increased breast cancer by 80%, right? Nobody tells us this, and we just kind of go along with these safe over-the-counter medications. So that's not okay with us. And again, when you realize our lifespan is getting worse, we really want people to kind of think differently, because what we're currently doing obviously isn't working, or we wouldn't be getting sicker and sicker. So Penny, if you can, give a little background on these lasers. We're going to get into a lot of laser research, but I had to paint the picture of why we use these and why we spent so much money on these, and why I'm going to buy probably 2 more over the next 5 years, because they're that important. And you can see the research on how harmful some of these things we're doing every day are to our bodies. So.
Yeah, so just a little bit of background on the Arconia Corporation. I work for Arconia. I've been with them for about 16 years. I've worked with chiropractors for about 20 years. And Arconia has been making these lasers for about 22 years now. And they were actually the first company in the world to receive an FDA clearance in 2002 for using these lasers for chronic neck and shoulder pain. Now, I still meet people today that have never heard about lasers, even doctors like yourself. And laser research has actually been in this country for 50 years. That's 50 years. So Arconia, being an American-made company, right now there's 21 FDA clearances in the world on low-level lasers, and we own 18 of those. So we can say we're the most researched, safest, effective laser on the marketplace, because we've proven it through very expensive randomized placebo-controlled double-blind studies, which are considered level 1 studies. So when Dr. Tim was looking at the lasers, and he's got a very successful practice, he just wanted to do more for his patients. So when you bring in an Arconia laser, and he's brought in quite a few of the Arconia lasers, what it does, it restores health within the cell. Every cell in the body needs energy. And when we lose energy in cells through toxicities, through trauma, through stresses, those cells lose energy. So what the Arconia lasers do is they kind of jumpstart through what's called the powerhouse to the cell. Every cell has mitochondria. So working through the mitochondria, it gives energy back to those cells. And when you do that, healing takes place. But it's a low-level laser. There's no thermal effect to the tissue. Actually, in most cases, you don't feel anything. It's a photochemical reaction within the cell, not a photothermal reaction. So when Dr. Tim uses it in conjunction with all the other great things that he does at his clinic, it just makes everything else that he does work better, because as humans, we're more toxic today, just like some of the things Dr. Tim was sharing with you. We're more toxic today than ever before. So using the Oconia laser, number one, it works, decreases the pain, it restores homeostasis within the body, and healing takes place. It brings down all that inflammation that we've kind of created in our body in this toxic environment.
Yeah, awesome. Thank you, Penny. So we're going to get into more detail on some of those things here, but I just want to show some pictures. Some people are like, what the heck is a laser? So this is what I call our smaller laser. It's same technology. It's just a smaller version of it. It's nice because I can take this on vacations or, out to events and stuff with my family. This is the bigger laser, so to speak. So both of them work amazing. This one I use on myself almost every day, whether it's my brain or my knee, which I occasionally have issues with. But I just wanted to show this. I laser my daughter's brain. She actually got a concussion when she was 2 or 3 years old. She actually fell off a chair, just a normal height chair, and actually knocked herself out, which was kind of scary. But we laser her brain at least once or twice a week to make sure we can heal that. So benefits of laser. I mean, I was totally skeptical of these. The first time I started learning about them, even when I bought them, I was very skeptical of them. And I just kind of pulled the trigger because I know the research was real. But since then, I don't understand why every practitioner does not have one or two of these. We could literally get so many people off medications. I mean, just change lives, really. I mean, these lasers are so powerful. We get testimonials almost daily. So you guys, I'm not going to go over all these words here, but you can see it's literally the most effective drugless treatment I've ever found. It's the most effective physiotherapy I've ever used, versus ultrasound, versus electrical stim or TENS units that we've ever seen. And it actually improves your healing time. It doesn't just help you feel better while you're healing, which it does that as well. So Penny, there's 2 slides here I'd like you to kind of just touch on a little bit. They're so comprehensive. It's not just about reducing inflammation. It's not just about healing quickly, but there's so many biochemical things that happen in the body when we get lasered. So I don't know if you mind just touching on a couple of these things.
Yeah, and this is a great slide because it does kind of break down exactly how low-level laser therapy works. And just kind of going back to, when some of the people watching this video here, when they see you lasering your daughter's brain, please understand that if you go to PubMed and you type in low-level laser therapy and brain, you're going to see valid publications where they've actually proven through studies there's a huge benefit to getting the mitochondria, which is the powerhouse to your cells, working better in your brain. So again, I know some people look at that picture and say, oh my gosh, but you can't put all lasers on the brain. And so again, when we have a full body FDA clearance, for pain, then it's important to know that you have to understand that there's only certain lasers that you can place on the brain based on non-thermal versus, there's cold lasers out there that are class 4 lasers that might heat the tissue. You can't put those types of lasers on the brain. So it's really important.
On that note too, you mentioned they stimulate the mitochondria. So some cells just have one mitochondria, but other cells have many mitochondria. So some tissues do respond a little more quickly than others. So I would say minimum 9 out of 10 things that I use this on for myself or my family, minimum 9 out of 10 things, we notice considerable faster, better healing and less symptoms and stuff. So I just want to touch on that because each tissue does have different mitochondria, but all cells have mitochondria. So
right. Yeah. So again, this is a great slide. I think it just kind of it's a synopsis of what lasers do. Scar tissue. I think what a lot of people don't realize is that scar tissue can play a havoc on the body from a global perspective. Whether it's a new scar, an old scar. Whether it's a small scar or a big scar. I've had 3 C-sections. I did not have an Erconia or access to an Erconia laser for my first 2, but I did my 3rd. I actually took the laser to the hospital and started lasering post-surgery right away. And I can tell you from having 3 C-sections, the sensation of the scar, the appearance of the scar, everything changed dramatically for the positive after I started using the laser after my third C-section. So when you come out of surgery, again, scars can play havoc from a global perspective on the body. So even to come in and, get evaluated and, for post-surgery and get a laser treatment, you'll be setting yourself up for healing for years and years and years to come. Yeah, and anti-inflammatory, that the lasers carry that. Again, it's perfected. That's why Erconia builds that 635 nanometer wavelength with a minimal output of power per diode. Vascularity, nerve function, that's why I know you talk about, some of the successes that you've seen with neuropathy cases. I know many doctors where a lot of their podiatrists are sending tough neuropathy cases, to chiropractors that have the Erconia laser because they're seeing tremendous changes. So that's another great, testimonial that you shared.
Awesome. So guys, I just want to go over a few statistics. This was studies in asymptomatic people. Most of us have symptoms, right? Most of the people have symptoms. This was asymptomatic people. And this is what we preach in our office. It doesn't matter how you feel necessarily, right? If I give us morphine right now, in 10 to 15 minutes, we're going to have 0 symptoms. We feel amazing, right? But just because I have lack of symptoms doesn't mean I'm healthier. I'm actually sicker because morphine has to be processed through my body and liver. But guys, they did a study, a bunch of different studies, but 1,200 people aged 20 to 70, for example, have 87% of those asymptomatic people had discs bulging in their spine. So you can have a lot of dysfunction, but not feel it, okay? So we all know that, your liver and kidneys usually can be 70 to 80% non-functioning before you have symptoms. So I always want people to understand, don't wait until you have symptoms to start fixing things, right? That doesn't really make sense to us. It's not like I'm gonna wait until I have my heart attack to start fixing my heart disease, right? That doesn't make any sense at all, but most of us are so symptom focused that we just don't pay attention to that. So now you can go back to the slide if you want, you guys. I don't want to bore you with some of that, but you guys, we all have dysfunction. And so these lasers are the most profound tool I've used that we've ever found, with more research than almost anything else out there showing benefit. And we've proven they work amazing over the last few years. So we are not skeptical anymore, Penny. So pretty much every disease process, you guys, is inflammatory. We all have extra inflammation. Our diets are not great. Most of us aren't sleeping properly. It's stress. We all have stress. So it literally just breaks this down. So when we have a tool that reduces inflammation, which again is almost every disease process, what can't we help, right? I mean, I'm not going to claim we're treating certain things, but there's a whole body clearance for chronic pain, which is really cool. So this is the picture of the small laser. Guys, this is a picture of the larger laser. We have 2 different lasers. There's multiple lasers, but these 2 pretty much help us treat almost anything you can think of. Just a few general things that Penny covered. Helps with pain, inflammation, blood flow, which is everything, right? Every cell in our body needs oxygen, which means we need blood flow. So if it helps with that, what can't we use this for, right? Improves memory and focus, and that's a lot of the brain research. If you guys want some more of that, shoot me an email and I can send you just phenomenal research on brain, Alzheimer's, anything brain related. The brain has lots of mitochondria per cell, so we can see a lot of healing happen with that, with concussions. That's why these are in professional sports teams and other places. So basically a little basic physiology. We have a pre-injury, healthy tissue, of course. When we injure something, it's damaged, basically, whether it's micro trauma or severe trauma. And if it doesn't heal correctly, if we don't have the proper blood supply and oxygen and all those things that are pretty complicated when you break it down, we can build up excess scar tissue, which can affect the rest of our body. I've seen shoulder injuries affect somebody's gait pattern, okay, how they walk, which is crazy. You don't think the shoulder would affect the gait, but it does. Everything is connected in the body, so we want things working synergistically with each other. So basically, Penny, I'm gonna let you kind of go through the really simplistic version of what the laser does. So people think it's not doing anything. Usually the first 1 or 2 visits, people kind of are just putting up with it because they trust us and they're like, well, I don't feel anything. I don't think anything's happening. But then we start to get some feedback. They're like, okay, I thought it was in my head, but it's actually my shoulder feels better after the 3rd or 4th or 5th treatment. If you can just give a real simplistic explanation of what happens when a photon enters the body, that'd be awesome.
Yeah, and again, there's lots of different photo biomodulation devices out there, whether they're LEDs or infrareds or a true laser diode like the Erconia. So it does get very confusing. So again, when you go in to see a doctor like Dr. Tim that has the Erconia laser, just know that you're getting lasered by the most research, safest, effective laser in the marketplace in the world, because they've proven it. So a photochemical reaction with the zirconia laser, again, you're not going to feel it. And that's why people really don't understand that, that changes are making place. So we have photon receptors on our cells. So when you're lasering your patients, you have over 40 billion photons coming out of each diode, and it only takes one photon to make a change at a cellular level. So those photons will dock on the photon receptors on the cell membrane. And when that energy gets into the cell, just like Dr. Tim said, it works through the mitochondria. So the mitochondria is like the battery to the cell. So when it gets in the cell and affects the mitochondria, that mitochondria has a response by giving energy through ATP, which is the energy to every cell. It drives ATP, it brings energy back to that cell, and then that cell can work at an optimum. And when that happens, healing takes place. And what I find is that 90% of the time, we can make a positive change in one treatment, but sometimes healing takes time. So if the patient doesn't have an immediate response, meaning the pain is better, range of motion is better, or muscle strength is better, usually I find that the patient will feel that change within an hour to 2 hours, or by the next appointment, or within 24 to 48 hours. And what I find too is that it's also important to drink water too. It's not necessary, but as humans, we're all depleted of water. So I find that if you're able to drink water, if you're coming in for low-level laser therapy, then I think it just makes everything work even better.
Yeah, absolutely. And I think a lot of people, you guys saw the slides we saw earlier. People are running to NSAIDs. Almost everybody I know takes ibuprofen, Tylenol, aspirin, something like that, other than the ones that we educate, of course. But a lot of us have heard of COX-2 inhibitors, right? These really invasive drugs, and they're terrible. So we have literally a natural laser therapy that does all of that stuff, but on a whole different level without the side effects. That's the whole point. When our lifespan is getting worse now, you guys, we need to change our mindset. We have to change what we're doing. You don't really want to follow the crowd or the majority on most things health related, because it's not working very well. So again, we can go real quick over this slide, but I want people to understand this is not a light therapy necessarily, right? We have practitioners that I've seen all over the place claiming their infrared or LED therapy is a laser, and they're absolutely not. It's a different frequency. They're all light therapies technically, but they're not doing the same thing. So you kind of touched on that. Is there anything else you want to add to that, Penny?
Yeah, and I think, for as long as that I've been working with zirconia and working with doctors, I think that's the biggest confusion, is because, a patient will go into a doctor's office, they have to put glasses on, they have to go into this private room. If you have to do that, chances are that doctor's using a class 4 laser on you. So class 2 lasers, and zirconia is a class 2 laser. Anything up to 500 milliwatts is considered a class 2. Anything over 500 milliwatts is now considered a class 4. But please understand that that laser that you're in that private room, you're wearing glasses, that could be a 40-watt laser. And if you look at some of the laser research out there with some of the class 4 lasers, if you're taking a photo, sorry about that.
I thought it was me.
If you're taking a photo thermal laser and you're getting lasered and it is 40 watts of power, if you're looking at some of that research, you'll see that some of the laser research shows that you can damage DNA in less than 2 seconds. And you have to be really careful. For the 22 years, so the lasers that you use, Dr. Tim, the zirconia lasers, for the 22 years, there's not been one side effect or one adverse reaction, because it's only 7.5 milliwatts of power per diode. And that's where we're getting that photochemical reaction instead of photothermal.
Yeah, that's awesome. Thank you. So guys, I think a lot of us can resonate with this. I mean, we all know the sun is good for us in healthy doses, right? I know there's a lot of people now that are scared of the sun, right? Because of skin cancer and stuff. But we know that if I go in a closet, for example, and I don't have any light, the body can't be healthy, right? That's what converts the cholesterol in our skin to vitamin D in our body. And vitamin D, we know, is preventative against cancer, right? We've read that research. So we all know light therapy is beneficial. This is on just a whole different level. So I just like to show this slide because people know that lights are obviously good for them. And can you break down maybe just a minute or so on the 3 FDA clearances, which is really unheard of? I think there's 21 patents or clearances now. What can you explain that?
There's 21 FDA clearances in the world on low-level lasers. Again, laser research in the US has been here for about 50 years. I think it's been in Russia and Germany a lot longer. It just took us a lot longer to decipher it because it was Russian and German. So out of those 21, Arconia owns 18 of those, because I'm looking at the slide, it says 16, but we just got 2 more FDA clearances. So with the FX, we have our first FDA clearance on the FX, which is the laser that you have, was plantar fasciitis. That was two times a week for 3 weeks. It's 6 treatments. They evaluated the patients 2 weeks post, 6 months post, and a year post, and it's over 80% effective. The second FDA clearance, which is chronic low back pain, that was a recent FDA clearance about a year ago. That was a huge feather in our cap and a huge feather in the cap for chiropractic, because again, it's a proven randomized placebo-controlled double-blind study that was proven. It was 2 times a week for 4 weeks. They evaluated the patients 2 weeks post, 6 months post, and a year post. And again, it's over 80% effective. And then the third FDA clearance on the FX 635 laser, which again you have, is that any chronic pain anywhere in the body, and again they did, it was 8 treatments. That was 2 times a week for 4 weeks. But again, you know, just going back to the picture of you lasering your daughter, Arconia is really investing research to look at, can these lasers help patients with Alzheimer's, Parkinson's, MS? And this book right here that you showed by Norman Deutsch, chapter 4 is all about rewiring the brain with light energy, with putting a laser, a low-level laser on the brain. Arconia right now, we are pending, we've already done the study, we're pending FDA clearance for the use of our lasers for autism. So that's another huge feather. So we're pending FDA clearance. We can't really talk about the study because we're pending FDA clearance. And again, you know, now that, you know, people are listening to this, they understand that they have more options if their child or if a family member has a condition that is feasible to come in and get treated with low-level laser therapy from you.
Yeah, that's phenomenal. So a lot of people may know or may not know this. Basically, lasers affect all of our cells, right? So our body's made of cells. It's really that simple. It stimulates the ATP, the energy in the cells, which helps them heal more quickly. But people know that the up and coming healthcare fields that will be the fastest growing fields in healthcare ever are brain gut health. And we have tools with, we all know probiotics are good for us. We have tools now that literally affect the gut brain. And they're saying they're really one of the same. If you have a brain issue, you have a gut problem. If I've had concussions or I play football or soccer, usually almost every time those people have gut issues, and vice versa. If somebody has, you know, constipation, diarrhea, maybe colitis or these other issues, usually there's some brain problems almost every time, whether I'm depressed or, you know, all these other brain related type issues. So this is huge, you guys. And again, these aren't new. I think there's over 50 years of research, Penny. Is that right?
Yeah, in this country, yeah.
Yeah, and so guys, these are in professional sports teams. We've been fortunate to have found out about these a few years ago and have been using them. We have hundreds of testimonials. We expect them now. It's not cocky at all, but we just expect them because we know the power of these. And again, we were skeptical. I was the most skeptical person out there until we kind of see this stuff start working. So guys, everyone has a physician inside him or her. We just have to help it in its work. The natural healing force within each of us is the greatest force in getting well. We know that if I cut my finger, my brain knows how to heal that. I don't have to be conscious of how to heal that, what enzymes, what fibrinogen to go there and all that stuff. I would bleed to death if I had to be conscious about it. So we really want to unlock that kind of innate healing potential. And this is the most profound way we've ever found. Penny, I haven't told you this story. I'm not sure, I'm not going to claim anything, but I had a patient that had an open wound and it was infected and it was nasty. It was literally not closing up. The doctors were totally confused. I told them, I think I donated the laser treatment. I'm like, I don't think this is going to work, but let's try it. We started lasering an open wound that would not close, and it literally started closing again. We didn't charge him for it, so I'm not claiming anything or whatever, but that the things we see with this are, I mean, I just can't even believe it, honestly. It's so cool. If it was up to me, I'm going to laser everything that everybody comes in with, and we do on ourselves and my family, and it's phenomenal. 9 out of 10 things we point this thing at and we give it a little bit of time, they do heal more quickly. So guys, again, like Penny mentioned, go to pubmed.gov and just type in these 4 words: low level laser therapy. There are over, I just did it earlier today, there are over 7,200 studies now This is the most beneficial physiotherapy I've ever seen. We've seen, you know, ultrasound research, electrical stim, TENS units, all that. This is profoundly the most impactful physiotherapy we've ever found. And it's so much fun. So reach out to me if you have questions, you guys. It's just Dr. Tim Harrigan at Sin Wellness, as you can see down there. Reach out if you have questions. If you want more research, I can direct you. We have a nice email we've put together that will give you a bunch of nice articles to help explain some of this in more detail. Go do some more research. Let me know if you want the brain research. I can forward that research to you as well. So Penny, you are awesome. I appreciate your time very, very much. I'm looking forward to more and more testimonials because we get them almost daily, and we're just trying to get louder and louder because you saw our lifespan is getting worse. People run to the medicine cabinet for almost everything now. And again, I have not had a prescription in 17 years almost. My kids have never taken medication. So this isn't some sort of voodoo weird stuff. It's proven. It's just not mainstream. That's why we're trying to get louder and louder to help more people, because people are sick and tired, and we're kind of tired of it. So anything else you want to add, Penny? I appreciate your time very much.
No, just thanks for having me here, and you know what you're doing to change the lives. I know, you know, through our conversations in the past, what you're doing for patients, and people will find you. I hope this video really kind of opens the door to people understanding that not only, you know, your expertise as a chiropractor, the lasers just make you do so much more with them, and it amplifies the already great work that you do. And I work with a lot of doctors, and I have to say, you are one of my favorite, because I mean, you've just, I see how you work. I see your passion for what you do. And just thanks again for letting me come out and talk about the Zirconia lasers.
Thank you, Penny. That was way too kind, but I appreciate you very much. So have an awesome day, everybody. Just reach out to us if you have any questions or whatever, guys. Have an awesome day, everyone. Bye-bye.